Greetings, everyone. I am Dr. Jeanette DeWitt with DeWitt Physical Therapy and Wellness. And today we are going to start a new Facebook Live series on our Tuesday events. And we are going to celebrate National Parks and Recreation Month. So this entire month, we're going to be talking about ways to enjoy, stay fit, and be active at your local parks. And today's focus is going to be about walking for fitness. And I first want to start by talking about the benefits of walking. Walking is a great low impact cardiovascular exercise. So for people who have joint issues, who struggle with arthritis, rheumatoid arthritis, juvenile arthritis, fibromyalgia, Ehlers-Danlos syndrome, any type of chronic pain, or even some mental health disorders like depression, walking can be a great way to increase fitness, but it's not going to stress your body or stress your joints. Now, the other thing that I love about walking is we're going to talk first here about road walking and using a paved trail or a sidewalk at your local park. And then we're going to talk a little bit more about trail walking because there are some different benefits. So first, the general benefits of walking is what I've already talked about, is low impact, great cardiovascular form of exercise. But it's also going to just help maintain your body weight. And this is big. There's a lot of chronic obesity-related disorders out there and diseases out there like hypertension or high blood pressure, type 2 diabetes, some forms of cancer can be related to obesity, and then cardiovascular disease such as stroke and heart attack risks also increase with inactivity. So walking is a great form of exercise that can combat those obesity-related diseases by helping you maintain a healthy body weight. The other thing that I love about walking is you can just do it anywhere, right? You can walk at the mall, you can walk in your neighborhood if you have sidewalks or wide streets. But preferably, let's go and experience some of the outdoors at your local parks this month and get out there and walk along those paved trails. And like I mentioned, we'll talk a little bit more about hiking trails too. Now, walking also in general helps improve mood. Exercise is a great way to decrease the risks of depression or help stimulate the brain, and so that can influence mood. We can also use walking to help strengthen the muscles, and because it's a weight-bearing activity, it also helps the bone to lay down more bone, so it helps to strengthen your bones. And then walking helps to improve balance and coordination because you're walking along even on a paved trail, you're walking on like a rolling terrain. If you've not been an active exerciser, then I definitely recommend starting on a paved trail instead of a wooden trail or wood chips or dirt or grass, things like that, because you may not have the stamina or the balance and coordination to work as hard as you would on a hiking trail, which brings us to walking on a hiking trail. Guess what? That's a great form of cardiovascular exercise too. In fact, you're going to get a better workout walking on a hiking trail versus a paved trail because the demands are going to be higher of you. For example, on a hiking trail, it's often even more uneven, more rolling, can be very hilly, very rocky. So it's going to test your cardiovascular system a little bit more. It's also going to test your balance and your coordination a little bit more. So if you struggle in those areas, the hiking trail may not be the first place that you want to start with your walking. You want to start with the paved trail, but you can have as a goal to advance to the hiking trail. Because it's going to be a greater cardiovascular exercise or form of exercise to be on a hiking trail, you're going to have more calories burned So it's going to help you maintain that healthier weight even more. The other thing is it's still low impact, so it's still acceptable to do for people who have joint issues or chronic pain issues. You just may need to walk a little bit less on a hiking trail comparatively to a paved trail, especially in the beginning when you're transitioning. The great thing about a hiking trail is that it's going to offer a lot of variety. So it's going to work your joints, your muscles a little bit differently than a paved trail, because you have to really pay attention to what you're doing. You have to pay attention to rocks, stones, changes in surfaces. The nice thing about a hiking trail is no hiking trail is, or I should say, a hiking trail is rarely the same every time you do it. And that's just because other people have been walking on it. Sometimes the weather, if it's been drier, the trail may be more compact, versus if it's wetter, it could be a little slippery, it could be a little muddy, and it could be a little bit more treacherous for those who have balance and coordination problems. What I love about the hiking trail is it does work your body differently. It works it harder, and you can get a little bit more of a workout on a hiking trail than a paved trail. But both of them are great, and both of them can typically be found at a local park. Even dog parks often have walking areas around them. And then your bigger parks, like your state parks, are going to have more of a variety of different levels of hiking trails. So you may see runners on them, you may see cyclists, you may see hiking, and you may see walkers. Trails can be used for a multitude of reasons. You just have to pay attention and be aware of your surroundings. Now, how do you start a walking program? Well, first thing, you need a really good pair of shoes. If you're going to be staying on a paved trail, you can I recommend running shoes. Go to your local running store and get fitted properly. You can also seek out a healthcare practitioner like myself, a physical therapist, who can help you determine what type of shoe is best for you. If you're going to be going on a hiking trail, you actually want to get a hiking or a trail running shoe, or a hiking shoe, because you want to protect your feet from the elements on the trail. For example, if it's stones, if it's slippery, that trail running shoe or that hiking boot is going to have a thicker tread and have deeper treads on the sole of the shoe, so that it prevents you from slipping, it prevents you from sliding, and it protects your toes from rocks, sharp sticks, and just the elements that you might be encountering. Now, beyond shoe wear, if you have not had an annual physical, then you want to make sure that you have an annual physical before starting any exercise program. So if you have not had a physical with a family physician or an internist or a DO, these type of physicians will give you an annual physical and let you know what your general health is right now. This is super important because you need to be having your blood pressure checked annually. You need to be having your cholesterol checked annually. And then you also want to be looking at any vitamin deficiencies and blood work that might be occurring. And then also just preventing other risk factors like diabetes, high blood pressure, potential cancer risks. All of these things can be detected by a physician. I highly encourage you to get an annual checkup. If you haven't had one in a while, definitely get there and do that. Cannot encourage that enough. So very important to know what your annual health is and to have a regular physician that you can, who's going to act as a liaison for you for other services. The other thing I recommend, and the American Physical Therapy Association also recommends this, is twice a year, just like the dentist, get a musculoskeletal evaluation by a doctor, by a doctor of physical therapy, like myself. This musculoskeletal evaluation twice a year will help you learn what your range of motion is, what your strength is, what your flexibility is. And that's key, because if you've not been exercising for a while, you may not know where your range of motion is. You may not know how flexible your muscles are. you may not know what your strength is. And if you go to start an exercise program and you don't know these baseline figures, you could actually injure yourself or hurt yourself or cause an injury. So we don't want to encounter any of that. We want you to be fit, we want you to be active, but we want you to stay healthy too. So I strongly encourage you to contact a doctor of physical therapy like myself and get that evaluation so you know what and where your starting point is. I call it a get fit evaluation. And if you are interested in contacting me directly, you can contact me at 262-842-2220. You can also visit my website at www.dewittptwellness.com and schedule for a telephone consultation, or you can email me directly at Jeanette@dewittptwellness.com. And if you're listening to this and you have friends and family who are all over the country, I have programs that I can do video chats with people, and I can actually measure their range of motion through the video chat through a program that I have. So it's not a problem if you don't live in southeastern Wisconsin for me to work with you. Be happy to do that and set you up with a program and connect you with some of the local services in your area. Now, beyond seeking a physician, beyond seeking someone like myself as a doctor of physical therapy, and beyond getting correct shoes to participate in walking, whether it's on paved trails or whether it's on hiking trails, I also suggest that you start slow. And this is where having that get fit evaluation is so important, because that would help me and help you as the beginning exerciser learn where your starting point should be. If you're an avid exerciser already, you can probably start with a 30 to 40 minute walk 3 to 4 times a week. But if you haven't exercised in a while, it might be just doing 10 minutes of walking 3 times a week as a starting point, and then trying to add about 5 minutes every week. Again, I wouldn't start that if you have not had a physical in a while, or if you have not been exercising. One of the really great ways, if you're a social exerciser and you need the support and the accountability of a group, join a walking group. Some of the local running groups also have walkers with them. Some of the local parks also have walking groups that regularly meet. And you could look at your local park system, see which one you are interested in going to, and then check out their website to see if they have regular meetings for walkers. Ask some friends. Instead of going out to dinner, ask if they would like to join for a walk and then a snack afterwards, or do the walk and then dinner, but something that's going to allow you to connect in a healthy way. And I often encourage families to sign up for a walking event, and like a local 5K or a 2-mile walk. A Thanksgiving Day walk is very popular throughout the country. And so signing up your family to walk together, and then I would schedule that about 6 weeks so that you have 6 weeks to kind of gear up for it, that event. But then you're connecting with your family, you're connecting with your spouse, your significant other. It's a great way to kind of talk, reconnect with your family members, with friends too. And that's kind of your family time. That's often lost in today's hustle and bustle of activities, but this is a great way to do something healthy with each other and reconnect and talk as you walk. I also encourage you to have fun. Sometimes we get a little bit competitive with each other or competitive with ourselves, and we're constantly, okay, I got to meet this race, or I got to meet this event, or I've got to walk at this pace. It doesn't have to be like that. It can just be something you do for fun, do for enjoyment, and just getting out in nature at the local park system, regardless of the season. You can just enjoy the outdoors. And in fact, research often shows that people exercise a little bit harder when they're outdoors versus on a treadmill or inside exercising, because their brain is stimulated by the outdoors. I strongly encourage you, again, to get out, celebrate the National Local Parks and Recreation Month by going to your local parks and really utilizing those resources in your communities. Many parks are free, or they have a nominal fee that you can pay for annually. But it's a great way to connect with your community, a great way to connect with friends, or even just get away and kind of escape from the normal routine. So I would encourage you, get out there, walk, be active, whether it's a paved trail, whether it's a hiking trail, just get out there and have some fun. Thank you so much, and I look forward to talking to you next week about cycling. Have a great day today and enjoy it. Thank you.